Good day, everyone. Today's article is titled Head and Neck Radiotherapy Effects on the Dental Pulp Vitality and Response to Sensitivity Tests, a systematic review with meta-analysis. It was done by a Brazilian group and was published in International Endodontic Journal in 2022. This systematic review with meta-analysis investigated the effects of radiotherapy for head and neck cancer on the dental pulp. The study aimed to assess available clinical evidence and provide a better understanding of the dental pulp status after radiotherapy, as there is no consensus in the existing literature regarding the effect of radiotherapy on dental pulp. The authors performed a systematic search of articles published until November 2021 across several databases. 6 clinical studies were included in the qualitative analysis. Radiotherapy was used for all the studies included, where the total radiation dose ranged from 60 to 70 gray, and only one study combined chemotherapy with the radiotherapy. Overall, tooth selection was standardized regardless of the quadrant and the irradiated area. Out of these 6 studies, 5 used cold thermal pulp test, 3 used pulp oximetry, and 2 used electrical pulp test for the assessment of pulp status. First, for the cold thermal test, 4 studies reported altered pulp response to cold test after radiotherapy began. The meta-analysis showed a significant increase in the number of teeth that responded negatively to cold thermal test immediately and 4 to 5 months after radiotherapy initiation. One study, however, reported positive responses to cold test 4 to 6 years after treatment. For the electrical pulp test, 2 studies found progressively higher readings in electrical test after radiotherapy. The meta-analysis of these studies also showed significant differences in electrical test values before and after radiotherapy. For the pulse oximetry, 2 studies showed a significant decrease in pulp oxygen saturation at the end of radiotherapy, but these values increased to near normal levels 4 to 6 months after treatment began. One study demonstrated normal pulp oxygen saturation 4 to 6 years after treatment. So this review found that radiotherapy for head and neck cancer causes significant alterations in dental pulp responses, but it does not appear to induce pulp necrosis. There were significant limitations in the included studies, such as not controlling for confounding factors and issues with the classification of interventions and measurement of outcomes. The quality of the evidence for this finding was assessed as moderate. The altered responses observed with cold, electrical, and pulse oximetry tests are not considered accurate indicators of the actual pulp status. And thank you.